Good afternoon. And today I have a pleasure of interviewing duo. It's the first time on my program. I have daughter and a father, Dr. Avis and Cindy Avis, but they both founded wonderful foundation called Airway Revolution. Everything related to sleep and breathing disorders, impact of breathing on human development, they actually trying to bring that education to the world. So good afternoon, and I'm so happy that you joined me.
Well, thank you for
Thanks,
having us. We're happy
Thanks,
to be
Maria.
here.
Glad to be here.
And in this interview, we're gonna talk about those millions of people who suffer from sleep and breathing disorders and how sleep apnea, snoring, and upper airway resistance syndrome affect human development, and also why modern medicine missing this root cause, or at least that's what we think in our dental world. And they Sydney and Dr. Avis, they try to investigate that through human stories. I'm very close to my heart. That's what I do with my book, because yes, science really affect life, but life of the patient, but also understanding of the provider, of the medical professionals, and they try to uncover through the both sides. And now I want to introduce my guest, as usually, as I do from my, I would say from my perspective. We met at MU conference, and I was amazed by the connection, or actually the team, patient and a doctor in the same time, father and a daughter, how together they trying to change, medical approach. And yes, Dr. Avis, he was a dentist. I mean, now he just retired from practical dentistry to focus on a foundation, and he saw the damaging effect of sleep and breathing disorder through his field, and they both put together a board of medical and dental professionals who involved in the treatment of obstructive sleep apnea for kids and adults. And Sydney, who is helping her father, was also a patient, and she has her own dramatic story and treatments, and I learned about that through the conference, through your lecture. And I want you to share with us, number one, what actually ignite that passion and the whole foundational story.
Great. I'm going to let Sydney begin, but I want to introduce it. I think there's almost three stories. One was the story of me as a dentist, beginning to recognize through education what might be wrong with Sydney. Then this story of Sydney's bravery to share her story with the world to hopefully help millions of others live better lives. And then the story of the foundation, which is how we bring those two origin stories to life to help people in a concrete manner. So, Sid, why don't you start with the first story of why we even went down this path?
Yeah, so it's interesting because now when I look back at, myself when I was a little kid, middle school, high school, the signs that something was going on are so clear. But at the time, I had no idea. My dad had no idea. So what did it look like? From an early age, I was a mouth breather. We had a black Labrador dog that I was severely allergic to. And we thought, whatever, she can survive. But I was hanging my mouth open, couldn't really breathe. I was diagnosed with asthma. I was very moody, had some behavior challenges. Then fast forward to school, I was a pretty consistent C student, even though I was working really hard to try to get those grades up and just couldn't seem to do that. As I got older, anxiety started to come into play. I had panic attacks. I struggled with mental health. Then I was diagnosed with thyroid disease. So kind of things just kept piling on top. Meanwhile, I was like this seemingly healthy kid. I was an athlete. I was, social enough. I was fine, but I was struggling kind of behind the scenes. And really only my family knew, because I would just push through. Because what am I supposed to do? I'm exhausted every day, but who's not, So we just kind of treated these symptoms individually. I would take asthma medication. I would take thyroid medication. I would try to change my breathing to help with my anxiety. But nothing was really getting better for me. And at this time now, I'm probably in high school, and Dad went back to start learning about orthodontics. And I don't know if you want to touch upon that.
Yeah, I was just curious, for those that don't know, from dental students, they keep orthodontics as a mysterious black box, and you should just recognize signs and then refer out. And after 20 years in dentistry, I think that really bothered me. So I decided I'd go back, and over 2 years, learn to do orthodontics to remove that mystery. And then I started practicing orthodontics. And no sooner had I started that, I heard of a guy named John Mew in England. And he had a very different concept that I learned about through the computer. And 2 weeks later, after first seeing his YouTube video, I went to England to study with he and his son. And it changed my whole perspective on dentistry and health. And it was the beginnings of me starting to put the pieces together for Sydney. And then I have to give Bill Hang, who became my U.S. mentor in orthotropics. And after a couple of years of studying with Bill, I presented Sydney's case, and he said, "You know what I'm going to say?" And I said, "I know you're going to say she needs surgery." And Sid knew I was presenting her case, and he said, "What did Dr. Hang say?" And I thought, like all my other patients, would be horrified at what I was about to say. And he thinks the only way to do is surgery. And Sydney said, "Okay, let's do it. When can we do it?" And I was like, "Whoa, I mean, we haven't done a sleep study. I don't have a definitive diagnosis. We don't know that would definitely help. That's Dr. Hang's opinion. It's my opinion, but we need to do our due diligence." And that's with my doctor hat on. As a father, I'm like, wow, I know this is a major surgery with a lot of risk. And I got to make sure for my daughter that I'm recommending something that the reward is going to be worth the risk. So that's how we started. Nothing is stronger than a parent's desire to help their child live a better life. And so it's not with my doctor's hat as much as with my dad's hat that I knew how much Sydney was struggling. I mean, she worked so hard in school. And now we recognize, I mean, she couldn't read something and remember what she read the next day. There was no deep sleep that was consolidating memories and thoughts and ideas. And so she'd wake up the next day and it was like her mind hadn't been studying for 4 hours the night before. And so testing in school was such a source of frustration, and the impact on her self-esteem, and her impact, if college wasn't such a value in my family, Sydney says herself, probably wouldn't have gone to college, except, that's what we do in our family. You go to college.
Of course.
She hated school because it was hard to be successful because of the underlying root cause.
Right.
I want to add, this is a very dramatic story. I don't want to interrupt you, but I have to say, in my practice, is not unique. I would say what you describe, even though you're such a unique individual and you accomplish a lot, but that story, I have to say, I hear every day.
Absolutely. And that's really why, part of the reason why we created this not-for-profit, because, our two stories came together there, and Dad had the idea, why don't we start filming this journey of trying to get a diagnosis of what's going on with you? And we didn't know if I was going to get a diagnosis, what, treatment option I was going to go with. if whatever I decided was going to help me. We didn't know any of this. We just kind of was like, let's try it, and it might help someone on a similar path. And that's kind
Similar
of where
path,
we
right.
started. Right. And it's a story we hear over and over again.
Over and over again. And I like what you did not hide from my audience about asthma.
Right.
Asthma, such a common story. Yes, I knew that story about your dog, but we want dog in the house.
Yes.
We want to have outside bacteria in a house in whatever shape or form it can be done in a modern life. In the same time, asthma happened, and then after asthma happened, medication might happen, which might make the whole story even more severe. And yes, asthma, that protection with the tongue on the floor of the mouth, it's like I, as a provider, feel it's like one piece pushing another piece, and they become a wheel, and they start working in a certain rhythm. But now on that wheel, we get the seasonal allergy, and we get anxiety and depression, and we get more medication, and we get high blood pressure, and we get diabetes.
Right. It's a never-ending cycle.
Never-ending cycle of collecting disease year after year, which for me, it has emotional impact on me as a provider. I open the chart and I see it over and over. And people who come to me, I look at the year they were born. Oh my God, they 3 times younger than me. That's make me so scared. This has a significant emotional impact, just like on you to create a foundation, on me to write my book and have this podcast, because I see it over and over. Now, my question to you, how come this, you create something so beautiful, and I want you to talk a little bit more about this digital library and, idea of the movie Patient Story, but in general terms, one movie cannot change the whole system. Why is it so fragmented in the medicine? Why medicine have such a different view on this problem?
Well, first I want to say, when I suggested to Sydney to prospectively film her journey, I want you to know that at the time, Sydney was a certified yoga teacher, had studied twice in India. She was a healthy vegan. She had studied Ayurveda for a full year. And so she was on the nutrition and exercise and stress management for a 20-year-old or 24-year-old. She was hitting it out of the park. And so I said, my goodness, but you feel terribly every day. You could just see it in her face and in her eyes. And she was reporting that, it was just, life was really hard. And so I said, my goodness, if in fact we fix your sleep and you become a different person, wouldn't that be an amazing story? Yes, it's an anecdotal story of one, but how many people are controlling the other 3 factors so well? And also you're young, so most people don't associate sleep disorders with young people. They think it's for overweight, middle-aged men. And so that's what really, in my mind, bringing my dental hat and what I knew about airway and sleep disorders, I said yours would be so unique. But again, I didn't know that we were going to solve it. I just was positively expectant, like any father would be, that, hey, we can do this. And Sydney, though, was willing to say, okay, Dad, if you think it'll help others, I'll let you film it. So we had friends that were filmmakers, and we filmed from the very first sleep study on. I mean, it was truly prospective. It was truly at great risk because we didn't know what the end of the story would be. I did remember saying early on that, if we just help Sydney feel better and live life better, we win. And I can say we're winners because Sydney's a different person. Then if we could help others live better lives, then we've given back to the world and the profession. So that's the second part of what we're trying to do. It's that simple.
Yeah, but I
I'm
will.
curious. I don't want to interrupt you, but Sydney, when you're gonna talk, I want you to illuminate why your grandfather had an orthodontic surgery. And right, am I correct? Right, your grandfather had the surgery. You mentioned
No, my grandfather was a dentist and my father, but he didn't have orthodontic surgery.
So he had just had opinion. So you're the first person in the family who had this
Yeah.
type of surgery. So to talk about, that experience, orthodontic surgery for Airway, and difference, how you felt and how you perceive change.
Yeah. So the experience, let's say going into it, I don't know why I wasn't more nervous, but I was so ready to feel like myself, even though I had only ever felt not good. Like I was born into this house that I was allergic to, and things just kind of kept getting worse. So I never really felt good. So I didn't know what that felt like, but there was like, I just knew that what I was presenting to the world was not my true self. And I wanted to access that person and I wanted to get there. So I didn't feel nervous. I felt ready and I was impatient. COVID kind of happened when my surgery was scheduled. So it kept getting pushed back and I'd be like, call the hospital again. Can't they get me? And, I was really ready for the surgery. And the recovery of the surgery was hard. It was about a 7.5-hour surgery where they brought my top and bottom jaw forward. They fixed my deviated septum, reduced my turbinates, and they brought my chin forward as well. So it was a big surgery. The recovery was hard. Like I'm not going to sugarcoat it. It was about 3 months on a super soft diet, like smoothies, like blended smoothies and like squirting them into the back of my mouth. It was intense and it was emotional and it was hard. And there were times when I thought, what did I do? Like, is this going to be worth it? Because it's not like you come out of surgery and you feel better. I mean, it's months of healing until anything kind of switches. But when that switch happened, it was a game changer. It's been 5 years since the surgery now. Mm-hmm. I'm a completely different person. Like my dad said, school was such a hard thing for me. And of course, I'm not in school anymore, but I could always read, but I would read a book and I would forget what it was. So I just, at a certain point, gave up on reading. What's the point? But now I love reading. I'm able to just kind of understand concepts and grasp things that I couldn't before. Even running this foundation, I know that that's just not something that would have been in my wheelhouse before the surgery. And it just wouldn't have been possible for me to keep things organized and, meet with different people and just keep things going. So it really changed my life. I feel like it gave me a chance to live the life that I really always wanted to live.
Yes.
So yeah, I couldn't be more grateful. And, the documentary and the whole project is not about promoting surgery. For me, that's what worked. And I'm so happy that I made that decision. But really our purpose is to share people's stories, not just mine, other people, other patients, as well as professionals, so that people who are going to our website and watching these videos and eventually watching this documentary are seeing that there's different options. It's not a one size fits all.
No.
It's different for everyone. What is someone's goal? Do they want to be treated or do they just want to feel better right now? Do they need a crutch to get them to a next step? Everyone has different goals. Everyone's willing to do different things. So it's really about showing options that are out there and helping people make the best decision for them.
But I have a kind of root cause question.
Yeah.
And I try to answer that in my book, through my understanding. Do you believe what airway disorders is a disease of evolution? And what in our lifestyle or exposure is driving that?
Yeah, I clearly believe that it's environmental. It's too short a time for these evolutionary changes. As you know, you only have to go back, whether it be 400 or 450 years to find the shape of the human skull was far different. It had room for all 32 teeth and had room for a tongue to rest on the roof of the mouth. There was, except for the affluent, there was very little dental decay. So what's happened in the last 450 years with the industrial and cultural revolution has totally impacted our airway space and the shapes of our faces and our heads, our cranium. So, the cultural evolution or revolution where, women went to work and no longer had the ability to breastfeed like they had in years prior, had an impact on how infants fed. And that has really had an impact on the development of the palate, tongue space, airway. And then fire has introduced softer foods. And so that was an environmental revolution where all of a sudden we didn't need to chew food like we did prior to fire. So food became softer. Then we went into processed foods and baby food where you just,
So we're not using the muscles to create those strong jaws.
Yeah. And then moving indoors and having house pets and carpets and, pollution and tainted foods. And so all these things have affected our sensitivity. So there's more inflammation, more swelling in the airways, more swelling of the tonsillar tissue and adenoidal tissue. So all these things are affecting that tube from our nose down to the top of our lower airway. And as that airway gets smaller because of whether it be inflammation or how we're growing differently, breathing has become more labored, more effortful, and that has affected daytime breathing and nighttime breathing and has negatively impacted getting restful reparative sleep. So I think the environment is the most significant factor.
I really hope with the education what you provide on your website, people will try to change.
Yeah.
Because we such a sophisticated human being, or at least we think that way, we can do some changes. And it's wonderful what you mentioned, the breastfeeding. A lot of parents or patients come to me and talk about, I was breastfed. How come I have it? And I always say, it's not one thing. It cannot be one thing, or, just like not one treatment, not one environmental factor. So it's so much more than that. And probably it's going to take us ages to really figure out or lined up all the factors what affected, as well as all the treatments what's possible. And it's so wonderful what you found, the treatment would help you. I'm sure it was not the first try or try number 5, but you found that a lot of people not able to find it. But I really hope now with education, they can make better choices.
Yeah.
And I think it's a double-edged sword because I'm thinking of an expectant mother, and this, not that I've ever been an expectant mother, but I've been the father of the husband of an expectant mother. But I mean, there's tremendous pressures of if your first child and the unknown, and now there's all these different things of what you should do to be, the perfect parent. And so this is not about perfection. And even with respect to airway and sleep, we're in a world where there is no perfection anymore. We can't turn back the clock 500 years. However, we can help parents understand behaviors that they can do that could promote a healthier child and somebody that can live a fuller life.
And give them the education so that they can make the choice that's best for them and their family.
Yeah. And also that if they recognize, signs that their child is struggling, whether it be tantrums and behavior issues or, struggles later on in school, or that crowded teeth are not normal, even though it seems common, but it's not normal, then that these are signs that, oh my goodness, beneath this could be my child struggling to breathe, struggling to get restful reparative sleep. And so that maybe it helps them make a choice that, hey, there's something other than, Ritalin or Formalin, that maybe we could help address their sleep, and they won't have to be on, amphetamines that have some downstream consequences.
Yeah, that's how beautiful you paint the modern human picture. Like, I didn't see it in a museum, but you paint it perfectly. I wish it would be the educational art together with your educational. So that's really true. So thank you very much for doing what you're doing, and we gonna put the link for your website underneath this interview, and the information about Airway Revolution Foundation with many professionals who support my book, and I'm so thankful for the impact, because we're doing kind of similar things, trying to raise healthier humans, but in the same time help the humans who are already adults to have a happier and healthier life.
Mhm.
Yeah.
Thank you.
Thanks, Maria.